Okay, so the first thing that we're going to do is practice getting out of bed because we had talked about you're having a little bit of pain just sitting straight up, which doing this crunching, I really don't want you to do until you get some good activation and stability of those deep core muscles, and that becomes easy for you. Because right now I'm sure what's happening is as you sit up, everything is kind of coming up. You can see my belly come up, and then that means that there's pressure down. You're probably also using a lot of momentum, and that momentum is going to be painful on your back and also providing a lot of abdominal pressure down into the pelvic organs. So what I want you to practice is knees bent. You're going to roll over to the side first and then press yourself up, and you're exhaling at each effort. So it's a, and if the bed was bigger, I would roll all the way over. And then as you sit up, you're going to use this opposite hand here, let the legs drop off, and sit straight up. So that should be way less painful, easier, and anytime you're holding your breath or doing that sound, then we know that it's not an effective movement pattern, okay? So now that we have that out of the way, we're gonna lay back down, and these are the core exercises I want you to do for at least a week until you can do up to 30 of them or 10 breath cycles, okay? And then we'll move on to phase 2 of abdominal exercises. So laying back down, you can do this on the bed or the ground. I want you to always use your hands to feel inside your hip bones to make sure you're getting that deep core activation or a little bit of tightening under here when you exhale and pulling in the lower belly. So first, just do 10 rounds of breath. I'm not going to do 10, but just do 10 rounds of breath where you're exhaling, pulling in the pelvic floor at the same time as you're exhaling, and pulling in the lower belly. Your body needs to get used to all those muscles working together to stabilize you. After you've got that down, we're going to do a couple different challenges. So those muscles work to stabilize you as your legs and arms move throughout the day. So we need to teach it to do that. So we're going to stabilize, pull in the pelvic floor, lower belly, exhale, and then let one knee come out to the side. You're only letting the knee go out as far as you can while feeling that this muscle is still in control, okay? So you see that I'm moving really slow, and it's actually a challenge to keep talking and stabilizing at the same time. If I wasn't worried about moving or stabilizing these muscles, I could just move my leg all day long, but I'm not doing anything here, okay? So really tapping into this deep core stability. I want you to be able to do 30 on each side with the same contraction, okay? Right now, you'll probably just be able to do 1 or 2 on each side, and then reset, do 1 or 2 more until you reach 30. The next exercise is called a heel slide. So you're gonna stabilize, exhale. I pulled in the pelvic floor, pulled the lower belly down, and then I'm gonna let one leg extend and come back up, okay? Again, we're only going as far down as we can while stabilizing, and then you can do both sides. If you feel like your pelvis is shifting or you're not able to stabilize, just don't go as far and shorten it up, okay? Now, I'm gonna do a few things with a band. I recommend getting a band. If you don't have a band right now, that's fine. You can just kind of move your arms. So, or you can put like soup cans in each arm or like 2 to 3 pound dumbbells. So, you grab a band really quick.